Good morning, good afternoon, everyone. Thank you for being here. We've got a lot of AIHEC support, so I really appreciate that. We have with us here today Dr. Sarah Llanque White. We are really excited to have her here with us today. She went through some of our Astana Institute programs, and we have known her for a while, so we're excited that she's now here presenting to us. Her presentation, as you can see, is my educational journey and career path through nursing. So we're really excited to hear this presentation. Before we get started, just a little bit, Sarah Llanque White is an Aymara Native and Filipino nurse educator and nurse practitioner. She obtained her bachelor's degree and postmaster's family nurse practitioner certificate from Jacksonville University and her PhD in nursing from the University of Missouri, Kansas City. She also did a 2-year postdoctoral fellowship at the University of Utah, focusing on Native American elders with chronic diseases. Sarah also keeps her nurse practitioner skills up by working part-time at Gallup Community Health Center. Pending approval, this is a federally qualified health center primary care clinic that addresses the health needs of the surrounding communities in Gallup, New Mexico. She currently splits her time between Gallup and Albuquerque Metro, where she enjoys spending time with her 2 fur babies, Gussy and Mama Dog. She loves to cook Indigenous Aymara, Peruvian and Filipino cuisine, participate in Tai Chi classes and chair yoga, and listen to music. Her favorite hobbies are swimming and aqua aerobics. So again, a huge thank you and welcome to Sarah for being here with us.
Great. Thank you so much, Maggie, for that introduction. I really appreciate it. Um, so my name is Sarah Llanque White. Right now, I work as an associate professor of nursing at the University of New Mexico, and it's in the Gallup campus. And I've been there since 2020. Um, and I started as an assistant professor there in the nursing program. And so we have a 2-year associate program that we implement. It's a concept-based curriculum, and we also have a bachelor's of nursing pathway as well. And it's been a joy to teach there. We have a diverse set of students. Majority of our students are native from the Navajo Reservation, which borders Gallup, and also the Zuni Reservation, as well as a large Hispanic population and Filipino population too. So we have kind of diverse group of students there. But thank you so much for having me. I'm going to go to the next slide. Oops. There we go. So a little introduction that I'll give you. My background is Aymara. That's the name of our, also the name of our language through my dad. It's Aymara tribe in Peru, and also in Bolivia. So our tribe straddles southern Peru, and also a majority of our people are in Bolivia. I'm also have Filipino through my mom, and we speak Tagalog. And my mom, there's lots of islands in the Philippines, so there's many languages and dialects. And one of the dialects she also speaks is Visayan or Cebuano. Unfortunately, my parents didn't really teach me their native language when I was growing up, partly because of the logistics. They were working, my dad was going to school, and so majority of time was spent with in daycare, which the people spoke English. So they did try to teach me a little bit of language, and as I grew up, I gained more just a basic knowledge of each of the languages. Um, I got to visit Peru when I was in my early 20s, which was really eye-opening and life-changing, and I'll talk more about that. It set the course of my whole career and my life kind of where my trajectory would go through and what I wanted to focus on in my career in nursing and also research. So I'll talk more about that. But in Aymara, we say hello is kami saraki or kami saki. And then to say so that's how are you doing? And to say I'm okay, it's waliki or walikiwa. And in Tagalog, it's "Kamusta ka? How are you doing?" And then we say, if you're doing okay, you say "Mabuti." So that's in Tagalog. So a little picture, this is a small picture of my family. Let me just zoom in. This is when I went to Peru, and my dad is next to me, and my little cousin is, I'm holding my little cousin. This is way back in 2000, I believe it's 2004 or 2008. So my grandma is in the far, far right over here. She has passed away since she passed away in 2013. But she was pretty up there in years. She was 100 when she passed away. And this is kind of how we live. We live with an adobe house, so it's made of mud and straw. And usually the roofs, and I don't have a picture. The roof is made of tin, but and that's for us, if you can afford it, that's great. But usually sometimes the roofs are thatch roof, so they're made up of leaves, or from like eucalyptus trees. Um, so this is kind of like a normal, like I guess traditional house. Um, and we live on right next to a big lake called Lake Titicaca. And that lake provides us with reeds to feed our animals, cows, sheep, llama, alpaca, and also fish. So there's rainbow trout in Lake Titicaca, which isn't native to the lake. There's also native fish too. But in the 70s, um, someone introduced that fish, and so we've been able to eat that as well as our native fish too. And then here's a picture of just my mom and her sister and a family friend down here. And it is, I went to the Philippines in 2006, which I met my aunt for the first time. So it was really a treat and special. Yes, and someone in the chat, Kathy said rainbow trout is the best. Yes. So rainbow trout was introduced to our lake in the 70s by, I believe, um, I think it was people from Canada brought it to our lake. We have tiny fish. They're kind of the span of like your palm or your hand, and they have a yellow belly, and they're a little bit bitter, but and they have a lot of spines, but we eat that in our soup. We have also little tiny, I don't want to say minnows because minnows comes from frogs, but they're tiny little fish, and we'll dry them out and salt them. And because the sun is so intense, it dries really quick, the fish. And then we'll use that as protein or a snack when we plant our vegetables or do our daily chores. So, yes, so that's a little bit of my family and the culture I came from. And my parents met at the University of Florida. They were international students there. And my dad came from Peru. They needed someone to work on uh, language project, Indigenous language project at the University of Florida in the 70s. They got a National Science Foundation grant. I believe it was Lucy Briggs, and she brought my dad to the United States, the University of Florida, to teach our language to students. And so that's how he came. And his degree was anthropology. And then my mom came to the University of Florida because she wanted a master's in dairy science, which unfortunately she never got that degree because she met my dad, and then she had me and my sister. But that's it's okay, it's faith kind of twists, there's twists and turns in our lives. But that's how we ended up in Florida and growing up there. Okay, I'll go to the next slide. So, a stroke of destiny, and it's kind of, uh, um, kind of pun intended. The reason I call it stroke of destiny is my mom had a stroke. She had a hemorrhagic stroke at the age of 49. I was 11, and it was, I believe, 1993, and my sister was 14, and that really set the course of me going into the nursing profession. One of the reasons was when she had her stroke, my parents didn't really get health care. They had full-time jobs, they had health insurance, but they did not know the healthcare system at all. And so when she had her stroke, we didn't take her to the hospital. I remember she had an intense headache and she was vomiting, and we just kept her in bed and told her boss, she's sick, she can't come in. But she had her stroke, and it took around 2 weeks for her to get well enough where she could go to see a doctor. And really, at the time, if we knew better and we knew disease process a little bit better, we would have brought her to the hospital and got her treatment. And later on, she's still alive, but she had a second stroke later in 2006. And so it left her left side weak and also affected a little bit of her memory. So that really set the course for me going into the nursing profession, because I wanted to know more. I did not want to be blind and not be able to help my family. There also was a fear of healthcare, like what is this? What are the medicines they're prescribing to us? Things like that. And I remember that my dad, when we would go to the grocery store to get her food, we would get pastries because we thought in our mind, okay, is she sick? So if someone's sick, then they should be eating something they like. And she liked, bear claws and puff pastry with strawberries and cream. And, that's not what's appropriate for a person who's had a stroke, especially if they've had weakness. They're at risk for choking, aspiration. And those are things we didn't know. So that really set the tone of me going into the healthcare profession. And also my sister too, she's a nurse as well. And so I remember we were looking at our local community college, and we thought we saw there was an LPN program, and it was advertised you could get your LPN license in 12 months. And we looked at the salary and we're like, wow. And back then, this was 1993, 94. The salary for, I think, a PN was like 19 grand, which now is is small, but back then it was a big money. And we thought, wow, in 1 year we could earn that much money and we could like take care of our family. So that's kind of what motivated us to go into the nursing profession. Okay, so just I can't negate that high school prepared me for college a lot. I was fortunate to go to we were zoned for a high school that had a strong international program and a strong business track. I took some accounting classes, typing classes, and at the time I thought, okay, I'm just taking it because I have to take it and to, pass the class and move on. And I took some business computer application classes to learn word processing, desktop publishing, but I didn't know I'd use this later. So for any of those students who feel that, okay, why am I taking these class electives? What is the purpose of taking these prereqs? I want to become a nurse. This has nothing to do with giving an injection to a patient. Um, if you want to get advanced practice nursing degree, like prescribe, this has nothing to do with prescribing meds, but it lays a foundation for your success in a nursing program. So, for example, if you need to write a paper, having those typing skills helps tremendously. Um, Knowing how to operate Microsoft Word, right? Now it's kind of uh, I believe, a lot of younger people, they know technology more, but back in the day, it was really a new technology. This was 97, 98. So a few decades ago, but it helped a lot. And at the time I was like, oh, I guess I'll just do this because I need to know it, and I need to get the grade in the class and move on. But um in hindsight, it helped me so much when I did go for higher education. So even though you might think, okay, this doesn't make sense right now, it will come together at the end. And I always tell my students that, especially new students, when they're doing their prereqs, they might not understand, why am I learning psychology? What does this have to do with nursing? Well, you're going to take a mental health, a psychiatric nursing class, and that those terms that you learn there, the physiology of the brain, the anatomy of the brain, how neurons work or brain cells work, that all has to lay the foundation for then learning the disease processes that affect patients. And how we treat them. So it might not make sense to you now, but it will eventually make sense. And this is the community college I went to in Gainesville, Florida. It's Santa Fe Community College, um, which now they call it Santa Fe College. So there's two. And I never thought, coming to New Mexico, there's Santa Fe Community College here in New Mexico too. So I sometimes have to just clarify. Oh, I went to the one in Gainesville, Florida. Um, but they had a dual enrollment program, which allows high school students to get college credit and take college classes, um, while at the same time fulfilling their high school credit requirements. So it was great because I could do my nursing prereqs and also get credit for example, a history class. So I could take a history class and it could count toward my associate AA degree, but it can also count for my high school diploma. So it was really great to be part of that, and it's still going on. And the great thing is, and now here I am at UNM Gallup, we also have a dual enrollment program. We have McKinley Academy, and and we have CCTE. It's more of a trades program for students interested in the trades, and we have another one, forgot the name of it, but we have three programs for high school students. So we have a large college age population, adult population, but also high school students who are taking college classes as well, which is great. I always encourage that and advocate for them, and it's great to see them taking college classes, because I was in that same boat too. And it's it plus it helps relieve tuition expenses. Once you graduate, you're responsible for paying for your own tuition, or finding ways to get it supported through scholarships. But they also cover supplies, which is really great. I remember I wanted to take an art class, and the art class, it was, I believe, Introduction to Art, and you had to get some art supplies. And through dual enrollment, it was around $50 worth of art supplies, because you needed a sketchbook, some charcoal pencils, colored pencils, because they'll have you do drawings, and some watercolor, and plus the brushes. Well, all of that ended up to be around $50. But if you did dual enrollment, you got a voucher, and the school, it was Alachua County Public Schools, paid for that. And so when I wanted to take, so I didn't take the class because I already got credit for my um, art humanities class. But I thought, okay, later on I'm going to take it, and then I had to pay my own, and I couldn't believe, it was $50. So now looking back, I always tell the high schools, if you need to take a class that is art or requires, a supply fee, make sure you take it when you're in high school, because they'll usually cover it. And they cover the books and the textbooks. Usually you'd have to give it back to the high school, because they'll reuse it for the next class. But for supplies, that they're yours to keep. So that was really nice. And one of the great things about coming to this college, it at the time I believe was the only community college in the nation with a zoo. They had a zoo, there was peacocks all around the campus, and they made these noises, and once or twice I did try to corner a peacock and try to pet it, but they would run away, or they can fly. They had an awesome bus system, that ran from, I believe, I remember it was like 5 AM to like midnight, and so you could take advantage of the libraries, all the resources there, and if you were a student, you got a discount on the bus system, which was really nice. They had a wonderful library, 5 computer labs, a planetarium now. Back in when I was in going there, they didn't have it, but they have a planetarium. And I mention this because when when I talk to a lot of our students who grew up in rural areas and they're going to a small college or university, um, I always tell them to take advantage of the resources they have there, because at the time I didn't. I remember going once to the zoo and that's it. And I thought, oh, probably every college university has a zoo, and that's not true. Not many colleges have a zoo. Um, I grew up in a college town, and the University of Florida at the time had 27 libraries. Um, and I thought when I went to the University of Missouri, there will be 27 libraries there to take advantage. And there is not, there was two. There was a health science library and there was the library at the main campus. And so my dad, when I left for my doctorate, he said, "This is an anomaly. You will never see." He said, "It's very rare to see what you have here in Gainesville." So he said, "Take advantage, and even if you go to some place where there's not much resources, it's still, you know, it's still something, and even when I went to, for example, Navajo Tech, I worked there and we had a small library, but it was a library, and I would tell the students, take advantage of it. There's it's a nice place to study, there's resources, there's computers you can use. And then on some days they would have guest speakers talk about their poetry, talk about their art. So it was a really great gathering place. And I always um, encourage students to take advantage of those resources. When I was in a dual enrollment, I didn't realize the resources I had, and I was like, "Gosh, if I could go back, I would go to the planetarium or go to the zoo every weekend," because it was free for students. So now they charge. So, but um, but yeah, it's there, and it's a way to also not just succeed in your classes, like through taking advantage of the library, but also to have some downtime. If you need a break from studying and your college or university has a gym, take advantage of that. Or if they have um like a basketball team or a volleyball team, and you just need a break and you want to watch a game, do that. That's there for you to have those extracurricular activities, and also have a balanced kind of school work life balance. So I always think about that because I was very focused on learning, but I wish someone told me in the beginning to at least take a break, have balance, because it's important. And I'll talk more about that as well. Um, so when I graduated high school, because they had a dual enrollment program at the community college, and partnered with my high school, Gainesville High School, I was able to graduate the high school diploma and an AA degree, which was really nice. It allowed the financial burden of doing the first 2 years of college relieved, which was great. So, y- I after getting my AA degree, I thought, well, I'm interested in nursing, but I also want to um, have a background in nursing before I jump in. And I would talk to the students in the nursing program, because they would be at the library, and I asked them, "Are you in the nursing program?" They said, "Yeah, we're in the associate nursing program." So I would ask, is it, how difficult is it? Do you think I could do it? And they would ask me questions, are you working? Do you have kids? And things like that. And so I tell them my story, and many of them said, if you're not sure, you want to just get your feet wet, do the CNA, the nursing assistant certificate, which it was just 1 semester. And so I was able to get a nursing assistant certificate. It was 1 term after graduating high school, my first year as an official freshman in college, and it was great. We learned vital signs, how to give a bed bath, um, preventing urinary tract infections in patients, um, basic hygiene and care, things that one might think is, oh, you should already know that. Well, no, sometimes people don't teach it to you. Like, for example, with urinary tract infections, we always teach our patients um, drink plenty of water if there's no contraindications for that. But also, when you cleanse the area, we call it the perineal area, um, you wipe front to back, so there's no cross contamination. And I remember when I learned that, I was like, wow, that's awesome. Like, there's some things you don't learn, in in home ec, and so it was really great for me to be exposed to healthcare, and it was kind of the introduction to nursing. I feel this class, and it was great. Um, Little did I know, and I later on, when I did my dissertation, I actually had to go back to my nursing assistant book because I used some of those interventions to share with the family caregiving. It was a workshop, a series for dementia caregivers on how to take care of their loved one with Alzheimer's disease. And so I went back and I had to, for example, transferring someone from a bed to a wheelchair, if they're in late stage dementia. So I had to go back to my textbook and then study it and then practice it and then share it with caregivers. So it was really a great way to kind of be full circle, but also lay the foundation of what was to come. So again, you might think, okay, why am I learning this? This is just basic nursing. So I want to learn more pathophysiology, how to prescribe all this stuff. Um, but sometimes um, those basic information, again, can lay the foundation to what you're gonna learn in the future. So after that, I ended up applying to the nursing program at Santa Fe Community College in Gainesville. It was a 2-year degree. It took 5 semesters, and we teach at Gallup a concept-based curriculum. And then this was back in 1999, so there was no such thing as concept-based curriculum back in when I went to school. So it was a traditional nursing program, and it was tough. It was very rigorous. Um, I remember, studying very hard for an exam and getting a C in it. And I was questioning, like, what am I doing wrong? And having to adjust how I study. Um, I definitely had to reach out to other students to see if they wanted to be in study groups. That helped a lot. Um, maybe studying alone. Maybe sometimes that's not the way a person likes to study with other people. Maybe they do better studying alone, and that's okay too. But it was a real kind of trial and error, that first semester, because I was trying to see what worked, what didn't. But it was a lot of hours into studying and also attending lecture. I believe it was like 9 to 12, Monday, Wednesday, Friday. But then Tuesday, Thursday, we would be in lab practicing hand washing, practicing perineal care, giving a bed bath, all this great stuff that actually I learned in the nursing assistant program, which helped me do well in lab, my first semester of nursing. So, but it was tough. It was I always tell my nursing students, when you first come in to the program, it's a lot, and it can be very time consuming. And I always say, think of this like you're in medical school, because it's your life changes, your way of thinking changes, and also um, the amount of studying, the amount of academic rigor is very intense. And so even though, it's a different field, it's not medicine, it is nursing, but it's still just as rigorous, and it's just as time consuming. So we always try to tell our students, you want to make sure, if you're taking a 1 credit class or a 3 credit class, whatever, that for every 1 credit you take, you should be studying at least 2 to 3 hours outside of taking that class. So if we have a 3 credit class that meets, um, let's say Tuesdays and Thursdays from 9 to 10:30, um, then the person should be studying at least 12 to 15 hours outside of class. And so it's sometimes an eye opener for some students, because they might think, okay, well, I can just attend class and then not study and then attend the next class and I'll be okay. But it's not like that. There's reading you have to do outside of class. There's lab. There's preparing for clinicals, like getting a physical assessment done, background checks, vaccines up to date. So there's a lot that goes into it that that is outside of learning the theory and the didactic part. But I always tell my students, I always tell anyone who's interested, that it is a lot of time, but it is worth it at the end. The knowledge you get is amazing, but and not only that, the financial security, the job security you get with it is great. So after I got my associates, I ended up doing the RN to BSN program at Jacksonville University, which was around an hour and a half from Gainesville, where I lived. And at that time, they just opened an RN to BSN program, and it was online. And it was wonderful. It took 1 year, an additional 1 year, to get the degree, and it could have took 2 years, but because I got my AA and when I graduated high school, some of those credits counted, and so I just had to take the classes that were required for the BSN program. I really enjoy the program. They use BIS education, which was um, basically they were like website designers, instructional design technologists. So they knew how to structure a class online. And so every class was set up the not the exact same way, but almost the exact same way. So um, each time you took a new class through online, you knew the syllabus was in this area of the website. You knew that these were the course objectives. You knew where what assignments were due, when they were due, and it was set up the same for each class. So then every class you entered in, you knew that it wasn't okay. I have to now navigate this new class and find out where the syllabus. It was exactly the same, and it was great setup. Kind of like Canvas, kind of like Blackboard for some students who've been exposed. But the good thing about this was they made sure that the syllabus was here, that it was set up the same, the patterns were the same, and so it was less stressful as a student to navigate and the website and try to find things. So I really enjoyed that program, and they kind of spoiled me, because when I took other classes from other programs and it wasn't set up like that, I get so like anxious, like, okay, what am I doing here? And where do I go? And I'd have to call the instructor, like, okay, I just wanted to make sure, is this the only assignment that's due? Because I can't see any other assignments. So having that set up like that was really nice. And yes, I will talk about my synthesis project that is right here, music therapy intervention in an Alzheimer's Day Center. So part of two classes, we had to do a synthesis class, which was our practicum, and then we had to do a community health class, each for 3 credits. And the community health class, we needed to shadow a nurse and in the community, and I believe it was 50 hours or 100 hours of clinical experience. And then and so that I think I did that at a elementary school with preschool pre-K students, and I taught them how to wash their hands and also brush their teeth. It was really fun and sweet. And then I also helped at the school nurses uh, they had us, it was a low income school in a really impoverished area of Gainesville. And so they didn't have a school nurse. They had a school nurse that was shared between like 5 schools. So they put me there so I could help with, medications and stuff, which is really great. Um, and then I did a synthesis project at, we called it Al's Place. Sometimes people thought it was a bar, but it stood for Alzheimer's Place. It was a model daycare. So the ratio, we call it a model daycare because the state of Florida designated that the nurse or CNA or nurse patient ratio was 1 to 3. So, which was great. That's kind of unheard of, especially in daycares or even in hospital settings, to have a 1 to 3 ratio. So that way, we call them the clients, had kind of like one-to-one care. They got more attention. And so I asked the coordinator, who was a nurse at the time, I said, what can I do to help our residents? And I told her I was taking a music therapy class through Jacksonville University's program. And she said, why don't you see if music therapy, the things you're learning in that class, if there's some music that can be soothing. So then when our clients have get irritable, or they get what's called sundowning. So as the sun goes down, they want to leave the facility, or they'll get more irritable, or they'll forget. So they'll start asking questions over and over again, like, where is my mom, or where is my husband? When are they coming? So then they get less anxious and they're not as irritable. As the sun goes on, as the day progresses. So that's what I did. And I played music in a quiet room, and I chose around, I think, three residents, or we call it clients, sorry. And residents are in a nursing home, clients are in usually home health or in like an adult daycare. So I did that, and I checked their blood pressure to see. That's how the marker of if they were calm or not. And if I knew more, I would have done more measures. But and it lowered the blood pressure a little bit, but I didn't have. I took statistics, but I didn't have the higher level statistics to know if it was significant, which kind of prompted me to want to get more education and do a doctorate degree. Um, so that was my music therapy. Uh, um, that's how I did the intervention with them. I used soothing music that they provided my music therapy class, and I exposed them to around 5 to 10 minutes of the music. And yeah, Alice Place Model Daycare was where I did my practicum. Great. Oh, okay. Thanks, Rena. I see you're seeking funding. Okay, for A&P technology. Yes. So Animotage table, we're still looking into that. That's one thing at Navajo Tech we tried to get because of cultural reasons. When I was working at Navajo Tech, we there's a taboo with Dene or Navajo culture on being exposed to cadavers and death. And so it's kind of like a big iPod table. It was the size of a big table, but it looks like an iPhone. And it has a picture of a person, a human, and you can go through the layers of the skin down to muscle, down to bone. And so it allows you to teach anatomy, physiology without having to have a cadaver, a live cadaver, or sorry, a deceased cadaver. um, and because cadavers are very expensive, they're few and far between. You have to have refrigeration for it. There's chemicals like formaldehyde that to preserve the cadaver that don't smell the best and are chemicals, so we don't really want to be exposed to that. um, and plus with the animatage table you can use it multiple times, and they even have for vet tech programs, they have a animatage table for avian, so birds, or equine for horses, and cat, and I believe dogs, and I think cats too. So it's a really great table, but it's super pricey, and but we were looking at trying to get a grant for the program to get that. It's very rare to have it in certain programs because of the costs. Yes. Okay, I'm just go. Okay, then sure. So after I got my bachelor's, I actually just after bachelor's applied for the master's in nursing program at Walden University. It was again an online program in leadership and management. It took around 2 years to get, and it was an excellent program in that it was very similar to BISC education through Jacksonville University, where the um the online setup was very smooth. You knew where to get your syllabus. They had videos, DVDs they would send us. They had lecture notes along with those DVDs. And I ended up doing a capstone project on a preparedness guide for the state survey of Alzheimer's Day program. Because at that time, I was helping the coordinator with uh, the state survey for us to get reaccredited and maintain our model daycare status. So I figured that would be a good capstone project to help the model daycare, adult daycare where I worked, and also for my master's degree. So I will say this. Um, when you in nursing school, when you are given the opportunity to do a clinical or a practicum, usually it's in your last semester. I always tell students that is basically an interview. Even though it's to get hours to complete your degree, they are watching you, they are seeing how you're doing, because potentially you could apply to as a nurse in that facility. So I always say, it's important just be on time, come at least 30 minutes before your shift starts, because you don't never know if there's going to be car trouble, or there's going to be traffic, or let's say you forget your stethoscope, so you have to go back home and get it. So that gives you some wiggle room. And even though you might be 30 minutes early, you can always go through, on your phone, you could go through an app to help prepare for the board exam or review notes. Now we have smartphones, so it's not like you're not doing anything waiting for your shift to start, but at least you're on time and you're not going to be late for it. So it's not going to be in vain. So I always tell my students that it's okay to be early, because you can always study or do something in the time between, you come to class and then when it starts. Okay. And then after that, and this again, I foreshadowed in the previous slide, I wanted to get a doctorate because I did not know how to do research, and I thought I could do more with music interventions and Alzheimer's patients. So it took around 5 years, 4.5, 5 years to get my PhD in nursing. I got it through the University of Missouri in Kansas City School of Nursing, and it was an online program, but they also had an on-site too. So if you wanted to move there and get more like take more on-site classes, you could. I ended up moving there after a year. So I spent the first year at home, did online, and then after a year, I moved to Kansas City, got a dorm. It was an apartment, but it felt like a dormitory. I was 27 at the time, and I also got a graduate certificate in gerontology. And that program was face to face. So that's one of the reasons I moved there, is because I wanted to get more one-on-one uh, mentorship with a researcher. And so that's what I did. I moved there, and I ended up working and doing my dissertation on with Alzheimer's caregivers or dementia. Dementia is an umbrella term. Alzheimer's is a type of dementia. So it was a psychoeducational intervention called the Family Series. It was basically six. It was a workshop given over 6 weeks, an hour and a half to 2 hours per week, and we talked about disease process, medications, activities caregivers can do with their families, how to take care of them, giving a bath, personal care for their loved ones, and also when or if a nursing home placement is something that they need to look into and what resources are there, and as well as caregiver burnout, caregiver stress. So it was a great journey. It was a lot of work, but I really wanted to just get more knowledge and see what else was out there in terms of the research. And it was a great program to be part of. Um, Thank you. Maggie mentioned what led me to focus my education on the older population. Well, Maggie, I remember in Florida, w- so thank you for bringing that up. One of the reasons is we have a large elderly population in Florida. And I remember when we had to choose our practicum site, many of my classmates chose pediatrics or women's health. Um, and I remember no one chose gerontology. No one chose working with older adults. And I thought, let me try this. I think there was a need there. And I loved it. I loved working with Alzheimer's patients. I was scared at first because I did not know how to interact with these residents, patients. But once I got to know them, once I got the lay of the land and got training on how to interact, it was wonderful. And their families were so appreciative of our care for them, and we also involved the families in their care. So for example, our care plans didn't just focus on the patient, the person with dementia or Alzheimer's. It also included their family members. So that's actually what led me to do my dissertation with caregivers, because I thought, well, they're the people that are 24 hours with the person. We should be helping them. We should be supporting them, educating them on how to give good care so they can take care of their loved one at home as much as they can until they need, let's say they need to place them in a nursing home, or what other resources are out there if they don't want to place them in a nursing home. There's home health, there's hospice, there's all these other things, adult daycare, so that's what led me to go into gerontology and thus focus on caregiver research. Thank you for bringing that up. And also, I'll tell you, my grandma too, she was 100 when she passed away. And I thought this would be great to learn more about aging and understand how to give better care to our patients who are aging and getting up there in age. Okay, and toward the end of my educational journey, I ended up doing a postdoc fellowship. A lot of people do not know what a postdoc is, so I will just explain it a little bit. So after a person gets a PhD in whatever field they want to get it in, whether it be nursing, education, engineering. They can go for more kind of education, but get paid to do that. And they can do that through a postdoc fellowship or postdoctoral fellowship. And so I did that through the University of Utah. It was a T32 funded position through the National Institute of Health and Institute of Nursing Research. And at the time, I was working at a small um, college in the Pacific Northwest, and I, I was interested in doing more with the research, but I couldn't. At the time, I didn't know where to look for a postdoc. I didn't know much about it, so I ended up teaching for a year, and then after that, I met a lady, Jean Tang, who is a nurse researcher at University of Washington, Seattle, and she was doing her postdoc at University of Pennsylvania. So I asked her, what is this about? And and I got more information, and I thought this would be great to do, and I could continue my research, but I wanted to focus on native elder health, um, and bring it full circle to indigenous people. So I gave her my information. She said, Sarah, if I see something, I'll email you. So she saw a flyer and she forwarded it to me, and University of Utah just got funded for a postdoc fellowship. And so I applied, and I got it. I ended up, I might have been an alternate, but I ended up getting it. And Mike Caserta, who was the director of aging at healthy aging at University of Utah, I used his tailored caregiver stress tool or questionnaire in my research study for my dissertation, which then helped me partner with him through the postdoc, which was great. And he remembered me. I remember having lunch with him, and then when I reached out to him to get support for postdoc, he said, "Yes, I'll support you in your application." So, sometimes you never know if you're going to see a person again, but always I tell people, always treat people with respect, because you never know when you're going to see them or if you're going to need them as your mentor. So I did a qualitative study with Native elders, and I asked questions like, what kinds of traditional practices do you use to maintain your health or to address your diabetes or high blood pressure? And what Western medicine do you use? So many of the elders, it was a small group, it was around 12 to 15 people. Many of them said they do use medication, Western meds, but they also use herbal medication that there was passed down from generation to generation, and also some meditation like smudging, um, things like that for their mental health as well. Unfortunately, I didn't have a chance to publish the research, but I did present a poster presentation on it. And then after I did my postdoc, I wanted to get back with patients and do more hands-on, because I felt I was kind of um, got away from patient care a little bit through research. So I went back for my postmaster certificate in family nurse practitioner, and I went back to Jacksonville, Florida, because they had a program. It was brick and mortar, and it's hard to find clinicals for nurse practitioners, so they already had their clinicals set up. And so I did that. It took around, it was a part-time program, and because I already had a master's degree, I got a graduate certificate. So it was just a few classes I had to take. Um, and then I ended up after that, um, oh, sorry, what do NPs do? I put this here because a lot of times people don't know what nurse practitioners do, but basically you're basically a nurse, but you have a little bit higher level of skills that you can do, and you can work with patients. For example, diagnosing diseases. There are certain procedures you can do, like stitches. You can do stitches. toenail removals, splinting, although nurses can do splinting too, um, and also prescribing medication. And and sorry, so we are almost at the end of our our presentation. So sorry about that. Maggie has a QR code here. So just to conclude, there were some hurdles. There is sometimes nursing, people have said there's lateral violence or bullying. I've experienced that in the nursing profession. Being the only one, I, I I believe at this point in my life, I do want to mentor more people of color to go into nursing and more Native people, because we need diversity and we need people that in the profession of nursing, to care for our diverse U.S. population, right? So it's important that changes, and it is changing. And so I'll just go to the next slide. You guys can read this. I did publish a book, How to Succeed in Your First Semester of Nursing. It's an edited book with other colleagues, and it's on Amazon. And I have just here some websites that I mentioned throughout my presentation. I'm so sorry. I did not realize there was time. Um, Anyone have questions?
And Sarah, if you just have a few more minutes, you're welcome to continue. I don't want to
Oh,
stop you.
okay.
And for those who can stay on with us, we'd love you to stay through the end of the presentation, but we understand if you have to hop off. But Sarah, you're welcome to kind of take a few more minutes to just work
Oh,
through some of these if you have the time as well.
yes, yes, I do. Okay. I will I'll get back to this slide since this is where I left off. What NPs do. So I mentioned a little bit about that. I also wanted to mention that nurse practitioners, there's also other specialties. I specialize in family nursing, which means I can take care of infant all the way up to gerontology, 100, over 100 centenarians. Uh, but there's also other specialties like pediatric nurse practitioners. There's nurse practitioners that are just work with older adults. There are geriatric nurse practitioners. There's also CRNAs, which stands for Certified Nurse Anesthetists, and they're actually one of the highest paid specialties in nursing, along with psychiatric nurses. Um, and um, and so they help in the OR operating room, managing patients who need to get operated on. They help with their anesthesia, which which is really great. And so we need more nurses in that profession too, especially nurses of color. I know Emory has a really, really good program. I went to a conference and I saw some nurses who are African American, and they did a wonderful presentation about being a nurse anesthetist, and not just an African American nurse anesthetist. They're young. They after nursing school they did, I believe, 2 years or maybe 1 year of critical care nursing and also OR nursing, and then they wanted to get their CRNA, and they talked about their profession and how they enjoyed it, but also the hurdles that they had to face. So there's all different types of specialties. And the great thing is, if you don't like one, you can go into the other, right? Okay, so let's go next slide. So some hurdles. Um, you know, uh, I don't want to candy coat um, my story, because there's great times I've had in the nursing profession, but I also want to be real with students. And there is also racism I experience, microaggressions. Um, uh, I remember, as a nursing student, sometimes I would experience being under nurses who maybe didn't want me as a student, or um, they would pair me with someone that um, might not even want a student with them. Maybe it wasn't reason, maybe they just didn't want a student, or they had a bad day, and they would say, rude things, mean things, even though you're trying to get through the day. So I don't want to candy coat things, but I will say this, that if someone does that to you, it's them, it's not you. The one thing that helped me overcome those issues was that you show up, right? You come on time. You're there for the patient. Um, you bring 100, not just 100%, 110%, right? 200% to the table, and you use your knowledge to give better care. And so that got me through those tough times. Um, Being the only one is not fun. We want to see more diversity in nursing. We want to see um, our nurses reflect the people we serve, right? So, for example, um, in IHS. IHS is wonderful, is a wonderful organization that provides care to Native populations on the reservation, and also in urban areas too. And so it's great because we can see diversity in IHS, and they give scholarships to Native nurses and allow them to come back to their communities or other Indigenous communities. Um, thank you so much, Regina. I appreciate it, and also Bradley too. Um, and give back, and also have a job, right? And represent. And so we need that in nursing. We need that in healthcare in general, not just nursing, but representation and x-ray technology, right? And laboratory technology and medicine, and seeing more primary care advanced practice nurses of color. That's in pharmacy. Thank you. Yes, we need that. And because we're seeing that now, our country is very diverse, and so we need that diversity. Imposter syndrome. I didn't know about this term, and until I heard it, and it's a term where you feel that you you feel like you might not deserve a position, because you might think, well, I'm not good enough. And that's so true. If you go through programs and you get your degree, you are good enough. And and we shouldn't feel that way. We should feel that we deserve to be there, and we have a lot to say, and we have a lot to give, and to give back to future students, future nurses, or whatever profession you're in. So there might be a time, and I've talked to my husband with this, that you might be the only one in your PhD program, or in your master's program, or even in your nursing program, or your CNA program, but that's okay. You deserve to be there. And um, if you're the only one, you can represent your culture, and there's going to be a patient who does appreciate that you're there, and there's going to be other students that appreciate that you're there too. And you what you bring to the table is so important. you know if you didn't pass that board exam for pharmacy, if you didn't pass it for nursing, for medicine, then the way I see it is, then why you have the chops, you can do it. You wouldn't be there if you didn't pass it, right? So take ownership of your accomplishments, and you have every right to be there in that position. Burnout is a true thing in nursing. It can be very stressful. And so I mentioned earlier in my presentation that when I was in college, I wish I attended like more basketball games, or the planetarium. They always had something every Friday night. So I tell you that because especially for students. it's important to study, it's important to do well in your program, but it's also important, just as equally as important, to get sleep, to 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 nurture your body, make good food for yourself, eat healthy, spend time with your family or friends that add to your life, that will provide you with a good work-life balance. Because then what is the point of going to work, 40 hours a week? What is the point of working this hard if you're not going to at least enjoy it outside? And always, I always say, try to find either a hobby or a passion project, because it'll get you through those tough times. Um, for me, I love to do aqua aerobics. I love to swim. Um, I ended up adopting two fur babies from the reservation. So those give me purpose, to wake up in the morning, and just the unconditional love you get from animals, that soothes my heart. So definitely find that work-life balance. I volunteered for pet rescue. That was awesome. And now at this stage of my life, I love traveling. I want to do more like with international work. That would be great, to bring students to other countries and experience how nursing is in those countries, and then share cultures, share what we know about nursing, and also learn what they know, how they're delivering their nursing care. So that's something that in the future I'd love to do. So
So,
again, oh
sorry,
yes,
really quick. Reno has a question.
yeah, go ahead, Rita.
Okay, great. Um, I could relate to what you said about your parents being international students and not knowing how to navigate the healthcare system. I think that's very similar for many of our indigenous tribes um, that have only been served by IHS, which can sometimes be an abusive system to be in. Do you know of anyone who offers maybe like a more formal way to train people on how to navigate the healthcare system?
Yes. I worked with Bainey, I forgot her last name. She was president of the Hispanic Nurses Association at one point in Kansas City, and she was a nurse navigator for cancer patients at Truman Medical Center. And she helped patients. We had a lot of patients of color, because it was downtown Kansas City. And so she helped them navigate the system, but her role was mainly with cancer patients. Um, the and I can get more information from her. It was a formal setup. She was hired in that position to to help patients navigate from being admitted to the ER to being discharged. So her title was also case manager, because she helped them with getting, after discharge, getting home health on board. How are they going to pay for their hospital bills? Um, Medication, educating them on what are they taking, what cancer meds are they taking, and what treatments, after the doctor talks about treatments, what is this? Do they have extra additional questions that they have about getting chemo versus getting radiation therapy? So yes, there are formal, I guess, programs out there that can help patients. They're usually under patient navigator or nurse navigator is what they call them.
Thank you. I'll make a note
Yeah.
of that.
Oh yeah, thank you. Yes, and I will say this, thank you for bringing that up. You're right. I did work for IHS as a contract worker for 4.5 years on Navajo Nation, and you're right. It's not, the system isn't perfect. There's room for improvement, I believe. Um, a lot of times the patients I would see hitchhiked to get to the hospital. It was a small rural hospital, and that's all the care they're going to get, you know? And so we didn't know if they would come back for follow-up because they might not have a ride. There's no public transportation in the area. And they
Mhm.
could be living 10 miles, 50 miles out in a very rural area with no electricity and no running water. So to discharge a patient, for example, as an NP, and they had, let's say, respiratory illness, I end up having to prescribe antibiotics even before. Usually we wait 7 to 10 days if it's a cold, um, because usually it's viral, but sometimes we can't wait 7 to 10 days because I don't know if they're going to come back or not. So we go ahead and prescribe antibiotics and just educate our patients, if this cold doesn't go away or if this flu, you can take this antibiotic, but please wait this many days to take it. And these are the symptoms you would want to see if you needed to take it. And we had to do that because let's say we didn't do that and they got pneumonia and they passed and died from it. That's not ethical.
Yeah.
So things like that, we had to tweak our practice because it's a very rural area. And again, simple things like uh, when I prescribe in the city, I tell a patient, okay, you need a headache medication. They can get it over the counter. I usually don't prescribe it, but with IHS, you have to prescribe it because a lot of patients don't have money to buy
Mhm.
the ibuprofen, to buy over the counter meds, to
Mhm.
buy bandages, things like that. So we had a paper bag, and I would go in this one room and we'd get, give them some bandage tape and educate, here's how to do a dressing change. And the best way to know a patient can do the dressing change is called teach back. So then I would show them how to do that, and then they would show back to me how they do the dressing change. And then if
Mhm.
it was great, fine, we discharge them. Another thing was if we had got patients in the emergency room, and let's say they haven't had a meal that day, we would get them breakfast, we get them lunch, and a lot of times, sometimes um, you know, it might not, you might not think, oh, well, why does that matter? Well, it matters because this person might go home without even having a meal. And they
Mhm.
need that protein for wound healing, for example. They need
Mhm.
it for their health. They might be diabetic. So things like that you might not think about, if you don't work in a rural area or on the reservation, but those are things, real issues that we face and we had to address. And patients were very thankful for that, and educated me a lot about, like if they couldn't come back, they were very real. They said, I need this medication now. um I also mentioned there's um, also, a lot of people have lack of electricity, water in certain parts of the reservation, Navajo Nation. And so, think about insulin. Insulin has to be refrigerated. So
Mhm.
what happens if you're diabetic and you have to take insulin? Fortunately, I talked to the pharmacist, and one of the insulins has a 30-day shelf life outside of refrigerator. So usually we'll tell them put it in a dark, cold area of your house, usually the north side of the house, right, where it's cold, and then they can use their insulin that way. But again, it's a 28-day, 30-day shelf life. You know, will they have opportunity to come back to get refills if they don't have transportation? We don't know. So those are very real concerns that what I was faced with working on the reservation. Yeah. Um,
Thank you.
no, thank you so much for bringing that up. Um, so yes, helping Native people navigate the system. It's a complex system, healthcare, and that's one of the reasons I went into it. Also, my mom, not getting healthcare because they did not know the system and they were scared. Honestly, it was like very intimidating to go through the doors of an emergency room. Wanted to see more people of color as a clinician, a nurse educator. What's awesome is the outgoing president of the American Nurses Association is a male. Usually nurses are it's a female-dominated position, profession, but he's a male and he's African American. I was so proud that he represented our nursing profession for I think a few years. He was our president of the American Nurses Association. Um, Indigenous nursing faculty are few and far between. I believe there's a nurse educator named Margaret Moss, and she wrote a book called Indigenous Nursing or Native Nursing. Um, and she is the only nurse that holds a PhD nursing and also a Juris Doctorate, a law degree. And she is really inspirational because she mentioned there's very few nursing faculty. Also John Lowe, he's one of the nursing faculty's Cherokee. He's a great nurse researcher, and they're trying their best to bring more Indigenous nurses into the fold of being educators. Integrating Native culture in nursing case studies. I'm trying to do that now with education. And so students will have more familiar understanding of certain disease processes, especially on the reservation and the environment and their culture integrated in our nursing case studies. So I'll come up with those just from my experience working on the reservation and with Navajo culture. And so we'll discuss those in class. And then I wanted to just mention the Native diaspora goes, to Canada all the way to the tip of South America to Australia, right? To New Zealand. So connecting with students, Native students from other regions, and talking about our experiences I feel important. So John Lowe has an institute. It's Indigenous Nursing Institute that he created when he was in Florida State University and then brought it to University of Texas, Austin. And so he does a lot of international nursing research, which is great. He connects people from South America to Australia to New Zealand. And it's interesting because there's a common thread of obviously colonialism and its effect on Indigenous people, but also healthcare and using traditional ways to heal. I know for him, and he's Cherokee, so they use the talking stick to talk about issues and to prevent suicide prevention and do a lot of interventions with mental health. And then also connecting with Australian nurse researchers to see what they do in their communities to address mental health too. So there's a lot of work to be done, but it's such a pleasure being here and being an educator, also being a clinician um, and just giving back to the community of Gallup and also here Albuquerque area. And in the future, I'd love to do international work and connect students with other nursing programs in other countries. So, and getting that experience to share cultures and experiences. Any other questions? Thank you so much for being here. Thank you, Regina, Darius, Bradley. I appreciate you, Maggie, Eric, Kathy, and Arino.
All right. Well, thank you so much for your presentation. I'm glad that we could hang out a little bit longer and get through all of it. It was really great, and we do appreciate you being here and presenting your journey to us. As was mentioned, if you can take the survey through that QR code, if that doesn't work for you right now, I will send an email out to you shortly so you can look for that. If you do have any other questions, feel free to reach out to me, and I will make sure to direct those to Sarah. There we go. Kathy, yeah. Kathy used to be one of our contractors, so
Oh
you
yes,
may
hi,
receive
Kathy.
some emails. Um, So if there are no more questions at this point, thank you all for joining us and for hanging on with us a little bit longer. And Sarah, thank you again. A huge thank you for you for supporting our AIHEC Health webinar series. And look for more webinars. This is our first one of 2024. Look for more coming throughout the rest of the year. All right. Thank you, everyone. Thank you, Sarah.
Thank you so much. Yeah.